What happens when HIV and sexual reproductive health and rights, SRHR, are not integrated into emergency preparedness and response? El Niño is more than a climate pattern. Across East and Southern Africa, our region, it becomes an overall emergency. Extreme droughts and floods disrupt food systems, livelihoods, and of course health services. Our report, which we developed with WFP and UNHCR, asks a critical question. What happens when HIV and sexual reproductive health and rights, SRHR, are not integrated into emergency preparedness and response? And what can we learn from positive examples? So in the last two El Niño events, we saw that clinics became inaccessible, supply chains broke down, and health workers were overwhelmed. And still, essential HIV and SRHR services were treated often as an afterthought. Despite risks of HIV transmission, gender-based violence, and early and unintended pregnancies increasing, the services were often not deemed essential. Young people, women, displaced communities, and people living with HIV face compounded inequalities precisely when they need the support the most. So our report shows that when HIV and SRHR are well integrated into emergency planning and response, health outcomes improve and overall resilience strengthens, especially when these services are led by communities and youth. Innovative approaches like mobile clinics, multi-month dispensing of ART treatment, and integrated health and nutrition services help people stay in care. However, our report also found many persistent gaps. For example, weak coordination, fragile supply chains, limited guidance, and fragmented data systems continuing to undermine HIV and SRHR integration. So in closing, I want to emphasize that climate shocks will continue and worsen. However, inequalities do not have to. So integrating HIV and SRHR services into emergency preparedness and response is not optional, it's essential to protect lives, rights, and futures.